Hello, thank you for joining me all today. I thought I'd do a little video around how I, as a coach, assess the runner as a whole, especially when they're coming in with an injury. Um, Not just looking at the injury, looking at how they run, and then going, this is what happened. There's a lot of different variables that cause injuries, so we can't just look at something in isolation. So I'm constantly asking, where is this runner likely accumulating the most tissue stress, and do they currently have the capacity to tolerate it? So today I'm going to go through the different variables, and there's quite a few, which could determine and which could all work together to cause an injury. And injuries, we have to understand there's like kind of two types of injuries. There is a traumatic injury. So this might be where someone accidentally lands funny and they sprain their ankle, so you have that sudden kind of that sudden pain, and it just happens after just that one movement. And then you have your overuse injuries, so these are accumulated over time and isn't just kind of one thing in isolation. There's usually quite a few variables that allow this to happen. So as a coach, what I look at when I assess runners is, again, a whole range of variables that will tell me different things. And then I come together at the end and look at everything and then kind of decide from there what approach we will go down to help this runner get back to being strong and being able to run again. So a big one is, well, not a big one, but I think a big one that people kind of think is the problem is foot striking. So we know that we hear rear foot is bad, or forefoot is better, or midfoot, blah, 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 blah. There's all these things, but really they're just two or three, so you got midfoot as well, different running styles, I guess, and everyone's different. Everyone's going to have a different running, a different way they're going to land, and that's completely okay. We aren't changing anything about this, but we are kind of trying to understand which joints and tissues tend to absorb more energy because of this foot strike. So for example, you'll see more injuries maybe present in people who forefoot strike in their Achilles, calf, etc., where rear foot strikers will have more load kind of going through knees instead. So that's a whole other topic and a whole other kind of lesson that I can do another day. But yes, there is different energy getting produced in different joints depending on what type of foot strike you have. So then you look at injury history, so which tissues have reduced capacity or higher sensitivity. So someone could come in as a rear foot runner. So for example, maybe a little bit more load is going through the knee, so you may see issues more around there. However, it's super important to look at their injury history because they may have previous Achilles tendinopathy. So you're like, oh, but they're a forefoot striker, so they're a rear foot striker, so why are they getting it in their Achilles? But then you've got to understand that, I don't know, they may have been running heaps of hills, and when you run hills, you become a forefoot striker. So you see, you have to be really careful on how you're assessing people. And then when people have had injuries, they may be better, but that tissue still has reduced capacity. So programming is super important around previous injuries. Strength testing, so current force producing and force absorbing capacity, which is super, super important and really cool to assess. However, most of the time you have to have like the certain equipment to be able to do this, which is usually super expensive. But if you do have access to that equipment, then it is super, super beneficial to be able to see forces that are produced in different limbs, so left and right, and so forth. Running volume is a really big area to talk about. So understanding, their training load or running load at this point in time, and then previous weeks or when they started, get the whole picture. And then when you have that whole picture of load, understand what types of runs they're doing, easy, tempo, mental block, threshold, fartlek, whatever there is. Figure out where their tempos are, what speed they're going, And that's really important to assess with running load as well. And then also how much that speed has increased over X amount of time. Hills, again, important one to know if they're doing or not, because again, this will change the demand, the foot striking, and increase the loading on the ankle and the calf. Terrain, so different loading patterns and stability demands. Obviously, if someone's a road runner, they kind of have that predictable kind of nature of just running on the road. There may be slight little differences here and there, but it's generally the same. But then you have someone going out in trails, and obviously the ground is constantly changing. You're running over sticks or holes or something like that. So your ankles are constantly kind of moving around and things like that. So understanding if someone is a trail runner, to remember that and to then be able to transfer what they need from trail running from their strength programming in the gym. Footwear is a really big one. So understanding what footwear they have on rotation, because this changes joint mechanics and tissue loading a lot, because we know just even a small drop in millimeters can make a huge difference to joint mechanics. So understanding, what they currently are wearing, how often they're rotating, and what shoes they're rotating with different types of runs. And then my favorite is movement quality. So I always assess someone's movement quality. So a movement competency assessment. So we're understanding how these people are handling load through all the different types of movement patterns. So your hinge, squat, push, pull, core, rotation, all of it. We need to understand how they're moving under load, because when they're out there running, it's the same thing. So if they've got some potential inefficiencies or compensations under load in the gym doing that movement assessment, then that's probably going to be translating out over into running as well. So all those variables kind of come together, and we need to understand so much. This is why my consultations are quite loaded with questions and just getting to understand the runner as a whole, because for me to do my best in their programming, I need to understand all these variables to be able to give them the best chance of loading their tissues and joints the best they can, to be able to stay a runner, not get injured, and then also run well. Because as soon as someone has an injury, runners tend to have this mindset of running through it. But then when they run through it, they then cause something else to happen, because something else compensates, and then they end up with 2 injuries, and then that's when they usually go see a physiotherapist, because they've got 2 injuries and now it's going to take even longer for them to get better, because they should have just gone and seen the physio for that first injury. So lots to learn. I'm still learning as a coach all these different variables. I find it very, very interesting. I'm going into my final year of sports science this year, and I'm doing advanced, I'm 6 months away from finishing my degree and about to do advanced biomechanics, which I'm super excited about, and I hope I can share a lot of new knowledge with you all when I complete this course. But yeah, if you have any questions, write them down in the section, and then remember to follow me on my Instagram, Improve with Brooke, where I post a lot about running, all things running. So yeah, hope to see you on here or on Instagram. Thank you.